I've always known that I was a doctor. I was kind of surprised when I got into dentistry that a lot of dentists do not see themselves as doctors. Other doctors do not see us as physicians. So I guess part of my makeup eventually was knowing that I was going to change that.
You know, we are a bodies of one unit, and yet we in the medical field tend to ignore the oral aspect of care and how that impacts people's lives. So I think that's what she's looking to hope that she can gain, and getting people from the medical field, different specialties, to really look at that connection, the link between the diseases and even the overall health of a person.
Isn't it amazing that we're in 2017 still talking about whether the mouth should be a principal part of the body that should be examined by every single physician prior to any type of surgery, any type of procedure?
Well, I'd like to commend Dr. Glasper for her insight in understanding the correlation and the need for the two specialties, dentistry and medicine, to come together so that we're able to provide better services to our patients.
I came here today to see Dr. Glasper because I found her movement Teach Me Dental, which is actually incorporating oral health into overall health, and I know how important the oral systemic health link is. I see it in my private practice every day, and I want to be a part of this movement, and it was very inspiring.
I bought into the whole oral and systemic health connection before I became a dentist, because it only makes sense, right? That your mouth is the gateway to the body.
I have been involved in this level of systemic and periodontal interactions since 1994. And I have been giving lectures on this for that long. And when she asked me, I explained to her, I've been through this, I've done this, I've gone down this road.
Having a discussion like this and being a panelist on a discussion where we look at, kind of flip the model, kind of look at kidney disease, heart disease, and diabetes, and then its relation to periodontal disease, and making a bidirectional kind of format, and really changing how things are done in terms of practice.
The bottom line is, this is a conversation that needs to be had even more than it did in 1995. We were only beginning to understand it in 95. And when physicians asked me, well, okay, there's an association, but how does it happen and what makes it happen? We didn't have the answers for that. And most physicians would say, well then, come to me when you do. Well, I do now.
I teach about the bidirectional relationship between periodontal disease and diabetes, and the students just eat it up. They love it, but I'm getting some resistance from some faculty.
What I realized is my patients didn't get that. Other dentists didn't get that. Other physicians didn't get it. And I thought, that's amazing that this very important part of your body is being excluded, as if it's sitting on a table somewhere and you're just functioning, right? So I felt like I needed to change it. I needed to change perceptions.
I am not sure what motivated you to do this, but you've taken it to a pretty high level, and I would encourage you to continue climbing higher and higher. Thank you.
I want to thank you for this morning, everyone here. This was an incredible meeting, and I hope we can do more of this.
I give Dr. Glasper all the credit in the world for putting this fantastic interprofessional program together. It takes a lot of courage to think out of the box, to be visionary, and she obviously is a visionary.
Today I felt like I tied everything together. As healthcare providers, we can make a difference. And I think people walked away feeling more empowered. Dentists as well as other physicians. So it was nice. I think the physicians learned some things today. I think they did. And I think they will never look at their patients' oral health the same again.